With this procedure today, as you're explaining, we're going to be taking the plasma and we're going to be taking a concentrated amount of that from my own body and we're going to be putting it into the area that needs some assistance in healing. It's going to send a message to send stem cells to that area. Do they have that correctly?
Right.
Could you explain to everybody like what are other ways that this can be used?
Facial rejuvenation, stimulate the growth of collagen, reduce wrinkle formation, bags under people's eyes, stimulate hair growth, can actually help to regrow a full head of hair. Women, there's something called an O shot. O stands for orgasm, and the women who have difficulty attaining an orgasm can get an O shot and they are now over the moon. ED, erectile dysfunction. Men who has issue attaining and maintaining an erection can be helped by using these therapies. PRP is great.
Wait, where do you stick the needle?
Right in the penis.
Oh my God.
No pain, no gain. There's some pain, but there's great gain.
Fair enough. Everyone, sorry to hold up the podcast here, but I just want to give a quick briefing on what this conversation is about. So I had a procedure done, plasma-rich platelets procedure done on my right knee. This was done back in fall of 2024 at Dr. Garwood's office. And this conversation is an in-depth conversation all about plasma-rich platelet therapy and the different use cases for it. I had it done on my left knee about 5 years ago, never looked back. And in this video, I'm having it done on my right knee because I've had some MCL issues. I actually tore my MCL almost 2 years ago, and it just was not healing properly on its own. So I decided to get PRP done on my knee again. And now, current day throp, I am running and training for the London Marathon on that same knee that was not healing. But there are so many other different types of use cases, and we go really deep into this. And I think this is important to know about, especially in this community, because it's not widely known. And I think it can really help people live a better quality of life. And as you'll see and hear, it almost seems like a miracle type situation. And it is literally using your own body to heal itself. So please enjoy this wide-ranging and very in-depth conversation that I have with Dr. Garwood, all on plasma-rich platelet therapies. Hello, Throppers, and welcome back to another video podcast episode. And as you can see, we are outside of the studio on the road, and I am here now at Perfect Health and Holistic Health Center in Sav-La-Mar Westmoreland, a little bit about 40 minutes outside of Negril. And I'm sitting down with my doctor, Dr. David Garwood, and today we're going to be having a procedure done on my knee known as PRP or Platelet-Rich Plasma. Got it. And so we're going to be having those injections done, but it's more than just you watching me struggle, wince, and maybe even cry going through this procedure. It's really an education that we're getting on these modern medical procedures and how perhaps they can help you with maybe chronic pain or a chronic ailment that you've been struggling with. And this is the second time that I'm having this procedure done. I had it done on my left knee with my patella. This was probably 4 years ago or so. And I've been struggling with my right knee over the last year when I tore my MCL from just overtraining. And so I'm more than happy to bring you along this journey of me hopefully making a full recovery, I'm sure. But also it's a huge education, and I really want to make the case for a procedure of this nature because it is natural. It is using your own body to heal itself, but at the same time showing you that these state-of-the-art health forefront procedures are available right here in Jamaica, right here in Westmoreland. So with no further ado, I'd like to take the opportunity to welcome Dr. David Garwood to the podcast.
Thank you very much, Winthrop. It's a pleasure to be on, and welcome to Perfect Health Medical and Holistic Center. In your introduction, you mentioned the procedure will involve using your body's own to heal itself. Now, for thousands of years, medicine have looked at various sources for healing. We have gone to the ocean, we have gone to the rainforest, we have gone everywhere, right? And we, for a long time, forgot about looking within. Now, with the advent of regenerative medicine, we now begin to look at what the body can do and how we can facilitate enhancing the body's effort to heal itself.
And with that being said, we are doing, like I said, we're doing PRP today. And could you explain to everybody in the most layman terms that you possibly can, what exactly is PRP and what will be the experience that I will be having today?
PRP is shortened or abbreviated for platelet-rich plasma. Now, your blood consists of two components, so to speak. You have a cellular component and a non-cellular component. The cellular component are the red blood cell, white blood cell, and platelets. The non-cellular component is referred to as the plasma. This is where you have proteins, antibodies, hormones, and other chemicals that are transported in the blood. Now, for the purpose of PRP, we are going to harvest the platelets. And platelets are these cells in your blood that is responsible for clotting your blood. So if you should get an injury, a cut, and you begin to bleed, platelets in that blood would come to that area and then, through some chemical processes, form a clot. This is actually where the fibrin, which is a mesh-like thing, occludes the blood vessel and with other chemical blocks the blood from leaving the blood vessel and hence stop your bleeding. Now, at that very same time, there are chemicals that are found within the platelets, referred to as growth factors. And these chemicals are signaling molecules in that they are messengers. So these chemicals would send messages to stem cells, which I will explain what stem cells are. In fact, stem cells are the body repairmen, right? These cells is what we actually grow from in the embryonic state. And we have these cells to repair the body as we go along, because there's always a turning over, a breaking down, and a turning over of dead, worn out tissue. The stem cell is responsible for doing that. So what these factors do is to invite stem cells into that area where you get that injury, where you get that cut, to start the repair. So within a couple of days, you heal.
Okay, so for example, with my MCL, which is a very important part of the knee, and with my running career, it's very important that this is a very, very, very strong ligament, right?
Yes.
Okay, right? And so I now have injured it, and I don't have full knee flexion. It's been over a year, and still in certain pain, especially in certain angles. And now, normally, if my stem cells were strong enough, so to speak, my body would have healed it on its own.
Exactly.
And from what I understand, like the MCL has poor blood circulation to that
Right,
area.
right.
And so now with this procedure today, as you're explaining, we're going to be taking the plasma, the platelet, excuse me,
Plasma.
platelet-rich plasma, and we're going to be taking a concentrated amount of that from my own body, and we're going to be putting it into the area that needs some assistance in healing. And based on what you just explained with the message, it's going to send a message to send stem cells to that area. Do they have that correctly?
Right.
Okay.
Right. So what happened is that when you got that injury, the body would have gone through the same process naturally, right? You would have had the platelets that were there and would have sent out message for the stem cell to come in and do the repair. Stem cell would have come, right? But what happened is that the process was incomplete. And with that incompleteness, you get into a state of chronicity where it becomes very chronic, that this inflammation is there but is not healed properly, isn't going away. Now, when that happened, the body seemed to now accept that you now have that injury and we're going to live with it. All right? Now, this impair your ability to do what you like to do. It impairs your mobility, and for some patients, their independence. Now, what these therapies will do is to provoke a scenario as if this is a very new injury. And so it invites in stem cells again to do the repair. At this point, stem cell comes in, and because we are concentrating the amount of growth factors from the PRP, more stem cells are brought into the area, and hence we are more likely to get a complete healing of that injury.
So, in a sense, we're kind of tricking our body,
right?
That like, hey, this happened.
This is acute, yes.
We need soldiers here now to heal this and fight this thing.
Definitely.
I see. And now, I don't know how familiar people are with PRP, but like I know it to be this therapy that is revolutionary in a way. And when I first got my patella injury on my left knee, one of the things that I always knew was cortisone. Like that was something that, especially like I used to play football, and like people used to get that cortisone injection and they'd be ready to go right away, right? But then my coach told me about PRP, and then we started talking, and then this sounded more like a long-term solution and a long-term fix, as opposed to, and correct me if I'm wrong, like cortisone will last maybe 6 months, and then you have the possibility of kind of regressing back, as opposed to like PRP. This may take longer for it for you to feel the effects, but you have more a long-term healing process. As like with my left knee, like it's been good to go and I've never had an issue.
Right. No. Partially, that is exactly it. What however, is the case is that cortisol or steroids, cortisol is a steroid, is one of the most potent anti-inflammatory that we have. Now, when you have an injury, there's always inflammation in that area of the injury. The body heals through inflammation. Now, you actually have pain also because of that inflammation. There are chemicals that are at play that actually cause you to feel pain. Now, when you put a cortisol shot in, it blocks that inflammation. But apart from just blocking the inflammation, it also suppresses your immune system. It actually stops your stem cells from doing the repair, right? And so the inflammation is quelled, you don't feel the pain, but there is no repair taking place.
I see.
Right? So in fact, you will still have that tear later on if you try to do something. Then quite often it even weakens a ligament. That is one of the reasons why it is very it's a given that an orthopedic surgeon or a doctor who is administering cortisol avoid putting cortisol in a tendon, in particular in very active persons like athletes, because when you do rapid explosion and the muscles contract, it can cause tear of those tendons because the cortisol weakens the tendon. So yes, stem cells, PRP, PRF, and other regenerative therapies, although they are in their infancy, is really that area now that give hope of the body doing what it was supposed to do in the first place, which is to do a repair of the injury, not just stop the inflammation and give you a good feel, but actually do the repair. The time for you not feeling pain can vary. As a matter of fact, the PRP itself is anti-inflammatory, so it can take away the inflammation, the pain quickly as well. However, what you will probably experience is where you get those shots. Those areas can be a little bit sore for a couple of days, 3 days, 4 days or so, you still feel a little bit sore. But in terms of the repair, the reparative process, that process has begun and will continue. Now, the various persons have different protocols. Although what I have found from my practice and personally using PRP is that you will improve up to, say, 3 months, up to 6 months. There's still an upward improvement in the injury. You can reach a plateau and you feel like we're not going any further now. We are at it. At that point, you can repeat. For steroids, the time is variable as well. 1 month, you could need another steroid shot. 3 months, you could need another steroid shot. So there are some persons who will routinely take 4 steroid shots in a year for osteoarthritis, for example, of the knee or of the shoulder, right? Because it doesn't go away, right? So you have to repeat to quell that inflammation that is there.
And so with the PRP, say you're coming back for round 2 of PRP, are you starting over, or is it building on?
Building on.
Oh, I see.
Building on.
Okay.
Building on. Because, all right, say we are going at your ACL and you manage to get 80% improvement, right, in functionality and the healing within, say, the first 3 months, right? But you plateau. You're not feeling any better, not going any further. Now, another shot will take you over the top. And what is reported is we're getting somewhere between 92 and 98% relief of your symptoms and also return of functionality from using regenerative therapies.
No, that's great. And there are people maybe watching this and be like, oh, Throp, he's an athlete, he's a marathon runner, this may not be for me. But I think back to my dad, like when I was telling him that I was coming to shoot this today, he was just saying, you know what, I remember like when I got it done on my knee, he's like, I've never had any problems since getting the PRP shot on my knee. And so could you explain to everybody like what are other ways that this can be used, and just
all right.
go through
No,
that. Yeah.
Like I mentioned earlier, that the repair men are really the stem cells, and PRP and regenerative therapies will actually mobilize these repair men. So any kind of repair that is required in your body can be harnessed, right, by using these regenerative therapies. We were focusing on injuries, like in athletes, right, and things. But you find that there are persons who will experience the itis, which is inflammation of different tissues. For example, the knee joint or the shoulder joint or the lower back. Very common. I mean, lower back, knee are probably two of the most common osteoarthritic areas that I have been seeing, right? You might have some person with hip and shoulder, but the lower back, the knee and the neck, by far, very common because it has to do with wear and tear on the body as you age, right? The repair that is seen when you are much younger does not happen when you are older, right? And so many of these conditions become chronic and it impairs people's way of life. They are not able to do the things that they like to do. They're not able to engage in activities that, really make life worth living. But when you use these regenerative therapies, you actually get a chance of repairing these chronic inflammation that is there lagging. Now, it could be arthritis, right, in different joints. Because it is doing repairs, it is used for a lot of other things like in aesthetics, for facial rejuvenation, stimulate the growth of collagen, reduce wrinkle formation, bugs under people's eyes, and all these things. It is used to stimulate hair growth. Persons who are getting bald, most often like male baldness, receding of the hairline, stem cells, and other regenerative therapies, PRP, PRF, can actually help to regrow a full head of hair. It is also used in sexual health, ED, erectile dysfunction, men who has issue, attaining and maintaining an erection can be helped by using these therapies. PRP is great.
Where do you stick the needle?
Right in the penis.
Oh my God.
Right in the penis. There are three shots, two to the side, one at the base of the head of the penis, and you're good to go.
I'm sorry to laugh, but
yes,
that's probably extremely painful because I just think back to like
the knee,
my left knee,
yes.
And then like I'm also thinking about what's about to happen to my right knee.
Yes, you could probably apply that no pain, no gain. So there's some pain, but there's great gain.
Fair enough.
Right?
Fair enough.
Right. But things like women, also we use, there's something called an O shot. O stands for orgasm. And the women who have difficulty attaining an orgasm can get a O shot, and they are now over the moon. And the thing about it is that there is a growing number of women who come into that area of not being able to experience an orgasm. I mean, a mountain of women, right? But they don't have no options. They don't know that an O shot could help. They don't know that, right? Well, I'm here to tell them that, yes, yeah, it works. There are patients who also have bladder issues, irritable bladder syndrome. Right? I have a patient who has been treated for an irritable bladder for years. She has so many different therapies. She have gone to the urologist and even done Botox injection in the bladder to relax the bladder so that she don't have this. It worked for a short while, but then she was back to having her issue. And if she was to travel from here to Montego Bay, she would have to stop probably 4 or 5 times en route to empty her bladder, right? We did one O shot, and now she could travel to Montego Bay, catch a plane, go to New York, and don't have to use the bathroom.
That's amazing. Like this sounds like almost like a miracle therapy, especially when it relates to quality of life, right? And you may not necessarily say, oh, this is a life-saving procedure, but it could be if you think from like a psychological standpoint, like if you're just struggling in life and you can't drive an hour without having to use the bathroom 4 times, and then imagine what that's like in terms of your sleep. It's going to change your mood. You're not getting enough sleep and doing all other regenerative things that your body needs to do throughout having a good night's sleep. And so how, in your experience, like how common knowledge is this therapy for the people out there? Like are people aware that this is available?
The first thing is that radiotherapies are in its infancy, so to speak. It started out where they were looking at using stem cells, but the research began using embryonic stem cells, and then that raised a lot of red flags, because then in order to get those embryonic stem cells, you would have to have aborted fetuses. And so there's pro-life people who would say, oh no, that is not acceptable. And so they actually put a ban on doing that research. Right?
Is that a global ban?
It was primarily in the USA,
Mm-hmm.
but a lot of scientists outside of the USA began to look at finding other ways of getting stem cells. So of course there are a lot of ways now to get stem cells other than using embryonic. You can have bone marrow, you have fat, and then you have blood, which you can get stem cells from. And there is also more recent development where you can now use a skin cell and in the lab convert that skin cell to a stem cell. Right? And of course, they have classification, like you have pluripotent and all this. These are just saying what are the capabilities of these stem cells. And they will make choices of different stem cells based on what needs to be done. But then it evolved to the point where instead of only looking for stem cells to harvest, how about reactivating those stem cells that you already have, right? Because even to get stem cells from the blood, what is done is that they would give you an injection of a substance that would actually cause your bone marrow to produce more stem cells and put that into the bloodstream so they can now harvest it from the blood. The other therapies like PRP, PRF, exosomes is a way of, instead of going for stem cells, we can stimulate the stem cells that you already have to do the work. There are instances when you can't get away from adding stem cells because, granted, a 60-year-old man has stem cells that are 60-year-old as well, right? And so the functionality of those stem cells are not necessarily what is going to give the best result, and therefore they have to seek ways of getting other products there that will be able to do the repair that is needed. And the larger scientific, in the larger scientific arena, there are a lot of other things that are being done. There are tissue engineering taking place, right? There are actually, like I said, trying to use any cell from your body to make stem cell. Now, a lot of these things will take a lot of time before they become mainstream. So even the use of therapies, regenerative therapies as it is now, it is still deemed to be experimental because we have not gotten to the point yet where it become globally accepted by FDA and the regulatory bodies.
Wait, so this isn't accepted by FDA
Right.
or approved, I should say?
No. What FDA does say is that you can actually do autologous therapies, which meaning that we use your own
Mm-hmm.
thing back on you. But stem cells, we can harvest your stem cells and give you that stem cell where it is needed. But it has to be minimally manipulated, meaning that we can take the stem cells from you, go into a lab, right? Multiply those stem cells by growing them
Mm-hmm.
many times, and over, say, a week or 2 weeks, and then give it back to you. In that case, that become now a medicine which will require registration and approval.
Mm-hmm.
So that is where that part of it is. If you are going to do major manipulation of the product, then it now become a medicine and require, different level of approval.
Okay, so right now, you would not consider these therapies to be mainstream.
No, they are not.
Mm. I think about like the future of medicine in particular as it relates to this. Where do you think that this could possibly go? Like how far in terms of let's think about the aging process and quality of life as we age, right? And is this something that can be in a sense considered a fountain of youth, right?
Yes, definitely. What happened is that we are living longer
Mm-hmm.
now, and there are a lot of chronic degenerative processes that takes place as you get older, and therefore the advent of regenerative therapies is giving us a chance to not just live longer, but also live longer healthier,
Mm-hmm.
right? So yes, and there's a lot of other applications. Look, we have conditions that are inborn, they are congenital, or they are genetics. Now, with the advent of stem cells research and genes therapy, we are trying to correct many of these conditions, many of these diseases. So we are going to be able, I hope, down the road to actually eliminate some of these conditions that we now have. For example, sickle cell anemia. We don't have any treatment per se. A person with sickle cell anemia will take folic acid. That's it. Right? They will still have sickle cell anemia. But no, if we can go in and change that gene so that this person no longer produce those red cells that are sickled, then we would have solved that problem. And that is also one area. There are many other conditions like that. We have been trying to transplant organs, heart, kidneys, right? Because there's a lot of persons who have chronic kidney disease, and the only way out is dialysis and kidney transplant. Then you have persons who have heart conditions. The only way out is to get a heart transplant. There are a lot of work being done in those areas to have the body repairing those organs instead of having to get a donor to donate you an organ. Diabetes, type 1 diabetes, stem cells, the beta cells that produces insulin, are now being transplanted into the pancreas so that it can repair and produce insulin on its own. So yes, it is the future of medicine as we speak, because there are a lot of work being done to get these things to the point where we know what to expect and we can employ these therapies for a vast majority of conditions that we have out there that right now there is no cure, so to speak.
So, kind of sticking along that same vein, now on the positive and negative side of this potential future, if there was no regulation in terms of stem cells, embryos, etc., like what could that world look like in terms of what could we really do to with the body in terms of longevity of life, increasing the quality of life, and then also what would be possibly the negatives of a free-for-all, so to speak. And you always hear people say that, hey, we can't play God. Like, what would be the two possible futures of that, of like no regulation positive, no regulation negative?
Well, there will have to be regulations, right? Because if there is no regulations, then, like you mentioned, playing God, there are persons who have their own agendas and they could do a lot of harm to humanity.
Like, could you give an example of like what that harm could look like?
All right. Now, not wanting to be controversial, but there has been time in history when some leaders think that they should have citizens or persons who are of a particular bloodline and they are supposed to be
Understood.
right, pure and things.
Mm-hmm.
And so now we could go into the whole thing now of making cloning who we want to clone, and this is what humanity would look like. And those persons who are just scavengers of this earth, we could get rid of them because they don't serve the purpose or they don't serve what we envision as what human beings should be.
Crazy. So you can basically, you'd be able to create a specific race, so to
Race,
speak,
so to speak,
and then you can have like, hey, everybody is going to be 6'5",
exactly.
all the muscle, blah 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 blah.
Yeah,
Okay.
you can create what you know.
So now, what would be something like? What would be like the precipice of the positive? Like what? Like, could we get to a point where you can make me a new heart?
Yes.
Yeah. Okay.
Yes, that's what I'm saying. So we are looking at being able to make you make a new heart, you make a new liver, a new kidney, and doesn't have to wait on a list for a donor who will have an accident and donate a heart so that you can get one.
So like you're almost like when I think, and I read this book called like How Not to Die, and in the book they basically make the case that people essentially, barring any accidents or trauma or anything like that, people don't die of quote unquote old age, and the majority of it why people die is usually in this modern age is some sort of lifestyle choice and what you're putting in your body, and maybe you create like hypertension or diabetes or whatever have you. And so it's like these micro choices that you've made over and over a long period of time, which eventually turn into a disease that you lose your life, and maybe you start to have a kidney failure or your liver failure or whatever it is, and you need these new things now. But is there a future where you possibly like you have these things and like, oh, your heart is not doing good or your liver is doing good, like, hey, let's make a new one, let's get the new one in, or like you said, like it healed itself, and like is there a future where you can just kind of live forever because you're just taking out parts that just keep you going?
Well, that is going to be an interesting future, and I guess there are biblical records of persons who have lived many, many years, 900 and
Mm-hmm.
plus years. So I guess we can strive to get there. And with the advent of a lot of these regenerative therapies and the knowledge that is coming forth as to how we can uh, maintain the functioning of the human body, then, you know, I mean, outside of regenerative therapies, there are lots of persons who are into the space of longevity, and they looking at, like you said, what are the supplements that we need, what are the deficiencies that are there, how to identify those deficiencies, and how to address them so as to help the body to maintain a healthy lifespan, so to speak.
Mm-hmm.
Right. So, it is interesting. It is interesting. There's a lot of things that are happening, and it may not reach mainstream for right now. And that is one of the downside to modern medicine, in that there are a lot of checks and balances, which is good too,
Mm-hmm.
right? So something has to go through a process. Right or wrong is anybody's guess, whether we should really have to go through those processes before persons who now have conditions that they are suffering with. Because if you have your ACL and we are going to have to wait 15 years more before it is approved that, yeah, we can do something about it, then you would have missed that one. Yeah, you wouldn't get your knee treated at all in this lifetime, right? But there are lots and lots of work, lots of research that are out there. They might not amount to the gold standard, and so they are not accepted by the regulatory bodies. They are deemed to be low quality research, or they can be anecdotal
Mm-hmm.
evidence, and that is not evidence enough to recommend that this can be used widespread. But there are many, 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 many doctors and clinics that offer regenerative therapies, and with tons and tons of testimonials of persons who get better and doing well.
Mm-hmm.
One thing I know is that if anything that flies and go fast is bad news. So if there were lots of incidences happening from these therapies, that would have been flying. We would have been hearing them.
Right.
So, yeah, you ask how much is this information, out there available to people. A lot of persons don't know anything about it.
Right.
A lot of persons don't know that these things exist. No, they don't know. Sometimes the problem is that there is a certain level of tardiness
Mm-hmm.
amongst health professionals. When I became interested in regenerative therapies, I started to look for institutions that have courses on it, and it was hard to find it, right? Eventually, I found that at Emory University in Atlanta, the orthopedics and sports department offers a course, right? It is not part of the university curriculum, but it is offered in the department of orthopedics and sports. So I reached out to them and made some arrangement to go for that course. Turned up there, and the assistant professor in charge of the course is a Jamaican. So of course we get to talk a lot, and And after he asked, what area of medicine am I specializing in? I said, I'm a general practitioner. I said, really? So how come you became interested in regenerative therapies as a general practitioner? And my team, we went to Jamaica 2 years prior to the conference of the specialists. And we presented there, and the scope of regenerative therapy for these patients. And 2 years later, we haven't heard anything from nobody from that time.
Mm.
So there was that level of tardiness in persons going after anything that seems new and thing.
But that's crazy to me. Like, as somebody who has felt the effects of this, that is life-changing, it's enabled me to run. I look at my dad, 80 years old plus, and he's saying he doesn't have any knee pain, doesn't even think about it. And what I also want to emphasize is that I remember when we first talked to my dad, this was a few years ago, we was trying to find a solution for his knee. And I talked to an orthopedic surgeon, and he was like, we got to get surgery on this right away. This is after doing the MRI and everything like that. And that got to be 2017, 2018, around there. And my dad was just adamant he didn't want to get surgery. And few injections, and that is no longer even an option on the table. And then you think about the risks that are associated with having these surgeries, not only the surgery itself, but the non-guaranteedness, if you will, of the surgery and the healing process. And you juxtapose it to the reality that we're living in now. Hands down, this is the way to go. Same with me with my right knee. I want to do like when I was doing my research, there are people who got the arthroscopic surgery that they are good to go, and they recommend it. Then there is the other 50% where it's terrible, and they have this chronic disease, they have arthritis, and it just didn't work out for them. And to me, taking a 50% chance on doing the surgery is just not worth it at 40 years old.
As a first choice. That is
no,
no,
not at all.
If after everything has failed,
yeah,
and the only thing that's left now is for me to do surgery, I can see that happening.
Right.
I have torn ligament in my shoulder, right? One of them was like 95% gone. I mean, it was barely holding on. And I have a friend of mine who is in this space, and he said, well, I remember having my shoulder done, and it was like, had to go in there and basically like, staple back that thing back onto the bone and things. And he said, hold on, I ain't going down that road right now. Right? Let's do PRP. And that same professor from Emory called him up, send my reports to him, and he said, come on now, and we can deal with it. So I went to Emory, have it done. That was 5 years ago. I couldn't take off any shirt, whether it was the one with this kind of neck or it was the one that is buttoned down. I couldn't raise my arm, so I couldn't take off no shirt at all. I couldn't put on no shirt. Did the shoulder, and I'm good.
And I really want to get the word out on this, and as I always say on my channel, even, from a financial perspective and real estate, do your own research, right? And to me, I'm presenting at this point in time, like real world cases and my own personal experience with this. And I just want it to be something that people take into consideration. And as I said earlier, like, hey, you can get this done right here at home in Jamaica.
Definitely.
So with that being said, I guess we can move on to the practical of this, which I'm sure everybody's excited to see.
And you are looking forward to it so much.
So much. All right, so yeah, let's go ahead and get that done.
All right.
All right, cool.